Good evening, everyone. Welcome to Colorful on our panel. We are live here on a Friday night, and we're excited. We have a guest, and what I'm going to do is I'm going to throw it to Rosalind Bates, and she is working. Go right ahead, Roz.
Well, welcome everybody. Welcome back to Colorful. We're excited about what we're going to do tonight. Welcome to a new experience for us. We want to thank all of our audience returning to us, and we also want to thank the newcomers, those of you who are joining us for the first time. Welcome. We're glad you would join us. We have a couple of things we want to cover before we dig in. We want to thank Moms of Beverly. Special thanks to them for helping us prepare the questions for our interview tonight. I also wanted to tell you briefly who Colorful is and how we got started. Colorful is fully embracing our Christian and cultural identities. We are a unique group of Christian women of color who serve as clinicians, counselors, psychologists, social workers, speakers, educators, and practitioners within the counseling and social work field. This group is designed to connect, network, encourage, share information, and encourage each other in our field and build our network. How we got started. We emerged in response to the shelter in place and orders in March, and we began our journey together by discussing self-care topics. So what we wanted to do is continue, and I thought it would be a good idea to invite our special guest for the evening, Dr. Jonathan Shepard. I'll be introducing him shortly, but I wanted to also invite you to share this platform. Valencia, can you give us some pointers on what we can do, how people can connect and share for this evening?
So, sure. If you can, drop questions that you have for Dr. Shepard. At the end, we're going to put some of his contact information where you can find him if you have more questions. So that's how you're going to be able to connect with him.
Okay, thanks, Valencia. I'm going to read Dr. Shepard's bio, and then Shania Gray will be presenting the questions we've prepared for him to answer this evening. Jonathan Shepard, MD, is an award-winning mental health professional. Named top doctor in the field of psychiatry, his holistic approach to wellness has made him a highly sought after and well-respected motivational speaker. Renowned for his caring and nurturing bedside manner, Dr. Shepard has served and provided treatment for clients in a variety of areas, including attention deficit hyperactivity disorder, mood disorders, anxiety disorders, obsessive-compulsive disorders, post-traumatic stress disorders, and many more. His mission is to help all individuals obtain access to quality mental health services. A graduate of University of Illinois at Chicago Medical School and adult psychiatry program, as well as the Johns Hopkins University Child and Adolescent Psychiatry Fellowship. Dr. Shepard blends professionalism and compassion to create healthier communities. He is currently employed as the Chief Medical Director of Hope Health Systems Incorporated, which has its headquarters in Baltimore, Maryland. Dr. Shepard serves on numerous boards and participates in several organizations that impact and shape the programs for the mental well-being of persons in diverse settings and various communities. He was bestowed the honor of Fellow by the American Psychiatric Association in January 2020 and Distinguished Fellow by the American Academy of Child and Adolescent Psychiatry in July 2019 for representing excellence and his significant contributions to the field of psychiatry. Welcome, Dr. Shepard. Thank you. We're honored and pleased that you would join us tonight.
Thank you. I appreciate that welcome, and thank you for allowing me to be with this esteemed group of ladies. And I appreciate the work that you all are doing. It is so important and paramount that we have quality information that is out on social media right now. And so I appreciate the work that you all are doing.
Okay. Good evening, everyone. Thank you, Rosalind. Thank you, Dr. Shepard. So my name is Shania Gray, and I will be facilitating tonight's panel. And I will just spend some time talking to Dr. Shepard and learning about from him. You know, we wanted to talk a little bit about the pandemic and what our kids are facing in the midst of school, and when we're thinking about safety and all the stressors that come with that. And so we had the privilege of having Dr. Shepard here tonight, and we said, why not? Let's take advantage of his knowledge, the wealth of his knowledge and his experience here. So Dr. Shepard, welcome. Thank you for joining us. We're so happy to have you. I know Rosalind introduced you, and I know you're born and bred here in Chicago, but can you tell us just a little bit about yourself and even why you chose to become a child psychiatrist?
Absolutely. I'm a native of Chicago, love Chicago. So all those Chicagoans who are out there, that Chicago is my hometown city. I'm a Black man, I'm a son, I'm an uncle. That is who I am. For those believers who are out there, I am a man and child of God. Professionally, I am a board certified child, adolescent, and adult psychiatrist, and grew up in Chicago. Did most of my educational training in Chicago, University of Chicago for undergrad, University of Illinois for medical school, and University of Illinois Medical Center for adult psychiatry residency. Then moved out to Baltimore to go to the famous Johns Hopkins University and to do a fellowship in child and adolescent psychiatry, and have stayed out here and have become the chief medical director for Hope Health Systems, which is the third largest provider of children's mental health services in the state of Maryland. And so that is no small feat. And so I'm grateful for the position that I'm in. Also board president for a non-for-profit called the Black Mental Health Alliance, which is an organization that works to reduce the stigma of mental health treatment within communities of color through education and consultation. So very active. This is my wheelhouse. I started out learning about psychiatry while I was in medical school. Believe it or not, my friends called me crazy for wanting to become a psychiatrist. And I believed them. I'll be honest with you. Because most of the psychiatrists that I knew, I was like, oh my God, they need one themselves. But I did a year, in between my first and second year, that's what I want to say, I did a summer of studying about child and adolescent psychiatry with a gentleman. And it was during that time that I began to understand the significance of child psychiatry and why they're needed. And I'll never forget working with this gentleman on the west side of Chicago. And we went to go see a patient. He didn't tell me who we were going to see. He just said, we're going to be seeing a patient, someone who has abused a child. So, I was thinking an adult. In walks this 9-year-old child. I was like, oh, he must be the child who got abused. Nope. He was the one who actually did the abusing. And I will never forget that, as you see. That was back in 2001. So 19 years later, I still have that image in my head of that child. And he was just reacting what someone had already done to him. And so from that moment forward, I saw how I could impact the lives of children who have been traumatized. And so that's where my love for child psychiatry was really ignited. And I love the brain. The brain is the command center of our bodies. If your brain is not right, the rest of your body will not be right. So I understand behavioral health. and brain as best as possible. So those are some of the things that got me into the field of psychiatry.
Okay. Wow, thank you. Very powerful. And just feeding off of that question, what has been rewarding for you as a psychiatrist? Now you spoke a little bit, and I want to talk a little bit about what has been difficult to see, which you kind of alluded to, in your one of your first experiences that is seared in your mind. So share a little bit, give us a little bit of insight into what has been very rewarding for you, and what has been really difficult to see as you've done this work.
Absolutely. So I'll start with the rewarding piece. So psychiatry is one of those areas of medicine where you see people get better. There are areas of medicine where you don't see people get better. You just see them tolerate what they have to deal with. And there's a difference between having to tolerate something and you actually being healed or cured or getting better. And so, not to talk about anyone, because I don't know who's out there at certain specialties, but any doctor who's out there, you know what I'm talking about. There's a certain specialties that all you can do is just move forward from after the initial insult. But psychiatry is one of those where you can actually see people bounce back. And so one of the most rewarding things is when I'm working with children, when they will come back and say, Dr. Shepherd, I can now learn because my ADHD is under control. Now, they don't say it like that, of course, but they'll say, I can pay attention now. I can see what my teacher wants me to see. I can learn. And children do come back and tell me that. This is not I'm not exaggerating at all. And that is what makes it worthwhile. When you have people who can come back, who can live their life fully, and even with the illness that they've been diagnosed with medication, with therapy, and other behavioral modifications, they're able to live a normal life, what we consider normal. That word is used so much and abused, I should say, but able to live a productive, let me say that, and fruitful life. So that is one of the most rewarding things. Let me tell you what hurts me, though. What hurts me is the stigma that continues to reside in people's minds about psychiatry. Psychiatry is not spooky. Psychiatry is not, oh, I get scared. The reason why people get scared is because they don't understand the brain. And there's so much to really understand about, more to understand about the brain. Most doctors, we know certain things, but we're always learning. But just because we're always learning doesn't mean that it should be considered spooky. Now, let me tell you, for Black people, I understand why they're scared to go to psychiatrists because, and there's a couple of reasons. Some places abused Blacks and used them as subjects that they should not have. Tuskegee experiment for one example, where they were trying to see the effects of the syphilis virus on the minds of Black people. And so I understand there's a lot of mistrust with certain institutions, but let me tell you, that should not stop you. So the stigma is what hurts me the most. And then to see people who that something's wrong with you and yet not do something about it, to be disordered and not be able to function properly. So the word disordered means that you're not functioning properly. And there are so many people out there who are disordered and not functioning properly and think they're okay. And you're not okay. And on the flip side, there are people who are functioning, but know they're not okay, and yet still want to continue to function. That's a problem. And that's when you know that you need to go see a psychiatrist. That's when you know you need to get into some mental health treatment. There is nothing wrong with seeing a physician who deals in mental health or a clinician who deals in mental health. So those are some of the things that trouble me the most. I'll say one more thing: the misdiagnosis of Black people in particular for certain mental health disorders. I am a staunch supporter of making sure that you get a proper diagnosis. just because you hear the voice of God does not mean that you are schizophrenic. And I'm not, again, exaggerating there. I had a patient when I was at the University of Illinois in residency. And this woman was on antipsychotic medication, strong antipsychotic medication, because a person of another ethnicity thought that she was schizophrenic because she heard the voice of God. I hear the voice of God. I am no schizophrenic. Not talking about him, but I know I don't have schizophrenia. And so I understood the culture. I understood what she was talking about. Took her off the medication. That woman was doing so much better. So those are some of the things that trouble me about what I see occurring within our field.
Thank you, Dr. Shepherd. And you know, as a therapist, a counselor, somebody who's worked on the West Side as well, in West Garfield Park and Humboldt Park, and then worked with homeless, mentally ill people on the streets of Chicago. I've seen a lot of what you speak of, and I've seen the mistrust and the hurt that our people have in trust in medical professionals, and in being, you know, they've been told certain things about themselves that they know aren't true, or they're being stereotyped and they're being judged, and it really hurts the trust they have in professionals to get help. And one of the things that I don't know if you could speak to, one of the things that I learned even in my work is that in Chicago, for example, 26 in California is our biggest mental health facility, right? Which, for those of you who don't know, that's Cook County Jail. And that's quite unfortunate, because we know African Americans are disproportionately affected by our penal system, by our criminal justice system. And when some of the guys I would work with who were homeless, they had just gotten out of 26 in California. A lot of times, most of them were mentally ill. And I would see that, you know, they got picked up for trespassing, or they got picked up for something minor. And the only place they would get the medication they needed was in Cook County Jail. The only place they would get the treatment they needed was in Cook County Jail. So can you speak a little bit to that, just about the care in a lot of our communities, in our neighborhoods, you know, seeing the lack of quality of care that really prevents and creates obstacles for people to be able to get the help that they need. Can you talk a little bit about that?
Oh, absolutely. So let me tell you, the pandemic that we're in right now, the COVID-19 pandemic, has kind of pulled the cover off on healthcare disparities. Now, let me tell you, healthcare disparities have always been there. Nothing new. But the pandemic has shown even a brighter light on these skeletons in our closet, so to speak. And really, it's not even a skeleton, because people have known about it but didn't care about it. And that's just wrong. So think about it. There's certain practices that refuse to go into certain neighborhoods. So why is it that the Black and brown and certain other ethnicities were catching the coronavirus more easily? It's not just because of comorbidities. That is not the truth, all right? The main reason is because as Black people, we had to go out and we were essential workers. And then when they said that we need to get tested, you had to go to a primary care physician. Most of these neighborhoods, they don't have primary care physicians. So how are you going to get tested for the coronavirus if you don't have here in Maryland, it wasn't until about June where they said that you can go without having a physician's note. Most of Blacks are going to the emergency rooms to get their health care. So you can't get the note from the emergency physician because that's not your physician. So, you know, we put up barriers, and that is one of the biggest things. There are barriers that are put in place that stop our people from getting the help that they need. So when they go into the penal institution, then that's where they get the help. And let me tell you, that is not the best place to go to get the help. I've worked in the juvenile detention centers, Hope Health Systems, where I work. We provide mental health services in 5 of the juvenile detention centers within the state of Maryland. And I've worked in them personally. And children will tell you, I wouldn't be here if I had stayed on my psychiatric medication. I mean, they just know it. They got off of it and began doing things that they shouldn't have been doing. And so there are just barriers that are put into our communities. And I hate to say it, it is intentional. I don't bite my tongue on this. I know what I'm talking about. It is intentional, where people do not go to set up practices. We don't have the personnel. We were talking about this earlier before the show started. You don't have a lot of people who look like me who are in medicine. And some of that is because they have put barriers in place to keep people of color out of medicine. That is shameful. Shameful. Standardized tests, which have certain biases to it. I know what I'm talking about. I speak strongly about it, and would dare anybody to refute me because the stats are there, the research is there. And so I had to learn how to take a test. I know I'm intelligent, but I have to prove my intelligence at a whole nother level than another counterpart of mine who just barely made it through and yet easily accepted into medical school. That shouldn't be. So there are certain barriers that are put in place that are very intentional that we have to tear down, speak truth to power, stop being afraid, call stuff what it is. Some of it is straight up racism. Some of it is just people want to have certain privilege. And then we have to lower the cost. Think about how much it costs to become a physician, to go into medicine. A lot of people don't have that money. And I ain't just talking about Black people. A lot of my white counterparts, they get as much loans as I do. They just don't talk about it. Uh, that's all. But if your family doesn't have the wealth, doesn't have the resources, or don't even know how to fill out the financial aid forms to be able to get the money so you can move further along, then you're not going to be able to go further into your education. So there's so many different barriers that are put in place that stop us from being able to stop us Black folks from being able to get to where we need to get. So then when it comes time to go look for a Black clinician, we're not there because the system that is set up in place, it is literally institutional racism, and it is real. And so we have to tear it down. I'm thankful for the people who are fighting. I like the energy. I like the momentum that I'm feeling that's in society today. We just have to continue to fuel it so we'll get more and more people into our fields. So yeah, healthcare disparities are real, and we have to address them.
Yeah. Wow, yes. So much truth there, Dr. Shepherd. And I know for many watching who submitted a lot of questions on kids and the pandemic and so on, and we will be getting there. But this conversation right now is so good that I want to just finish off with a few more questions as it pertains especially to the Black community. So one of the things that I often think about and I've learned about, and I know you know about, is you know about the violence in Chicago, of course, and we know how. And I will never forget when I worked in Austin for a community mental health center. I counseled a little girl who her brother was killed on her doorstep. Her brother was killed right in front of her on her doorstep. Wow. So she was traumatized. Can you talk about how that trauma really affects the brain and affects our kids? So much so that there's this cyclical effect happening and people are just like, oh, they just, you know, it's almost like people discard them. Oh, they're just horrible people. They're just horrible kids. Can you talk and help us understand what is really happening here? And speak a little bit about that.
Yeah. How old was the young girl?
Oh, this young lady I was talking, she was about 7 at the time.
7 at the time. Wow. So absolutely. So a 7-year-old, definitely their brain is able to recall what has happened. And so, yeah, at 7-year-old, she may not understand why she's doing what she's doing. Well, I say this, most adults don't even understand why they do what they do. But yeah, a 7-year-old, I tell you, yeah, it's probably very difficult for her. She may have nightmares. Mm-hmm. She could have trouble sleeping at night. She may not want to leave her house. She may have seen the person who killed her brother. Think about it. If it had been the police, when she sees a police car, she may run and duck. I've seen that happen. There was just a video that went viral just a couple months ago with a young boy who was playing basketball in his front yard driveway. Police car drove by. He ran and hid behind the van when he saw the police car. Trauma. So all these different things that children can portray that they've been traumatized. One thing that I have realized about children are resilient. And so we have to make sure that that 7-year-old gets the help that she would need. Trauma occurs in so many different areas of our lives. You don't have to witness someone shot and killed on your doorstep to be traumatized. You can be traumatized by watching the news. People were traumatized as they watched George Floyd's breath leave his body as the police officer's knee was on his neck at a pressure point, and his life literally evaporated in front of us. Children were traumatized by that. And we have to be careful what we take in and allow our children to continue to watch. What happens is with our children, they have seen so much violence that they become desensitized. And when you become desensitized, you'll end up doing things that when a red flag goes off, because you are desensitized, you will continue to do it. That is a problem. And that really concerns me. When you see something, you're like, oh, that's nothing. That's just something that I've already seen. That's a problem. Case in point, I have a perfect example. I'm here in Baltimore. Freddie Gray was murdered by the police. Again, I can prove that. Was murdered by the police. All right. Unfortunately, no one will be held accountable for his death. How is it that a man who was handcuffed in the back of a police van, you see, I speak strongly about this stuff. You kind of get me wound up here, and yet ends up dead by the time, well, he wasn't dead just quite yet, but he was almost dead by the time he gets to where their destination is. Something's wrong with that picture, and no one is held accountable. But let me tell you, when he finally did die, there was riots that broke out in Baltimore. And there were a group of children who were in the day hospital at Johns Hopkins. And the driver who transports them back and forth, the day hospital is where children go who are having acute mental health issues and they can't go to school. That's just so some people know what a day hospital is. So they had come in the morning, the afternoon, the riots broke out. The driver was scared. A grown man was scared to take those children back to the area where the rioting was occurring. Guess what the children said? Oh, we see this every day. Come on, let's go. That is a problem. That's a problem. But the children said, oh, this ain't nothing. We see this every day. And we as parents, we as guardians of the children have to wake up and realize that our children are being traumatized by the stuff that we allow them to see. And we have to take control and make sure that it doesn't become normal to see someone killed in front of us. That I will never accept. You will never get me to accept that, that is normal. And so we have to, if I can leave anything with your viewers today, is that by the time you've heard me speak today, there should be something that's rising up within you and say, what did that Black man tell me that I need to get up and do something about what is happening in my community and to the children who are our legacy? And so before I digress too much, I told you I could.
No, I know I could go on talking about this. But let me just wrap this up by asking you. So if a parent is questioning if they need to get help for their kids, where is that balance? Because I've heard a lot of, I too try to advocate for mental health in the Black community. My husband pastors on the West Side, and so we try to destigmatize mental illness and advocate that sometimes, help is needed. What can you share with a parent and question it? Well, should I take my kid for help? Will they be misdiagnosed? Especially when we talk about issues like ADHD and bipolar and so on, and you hear, oh, I never had ADHD growing up. I got two slaps and that was it. And I was fine to go or whatever. How can we speak to our community specifically about when to get help, especially for kids? How could you, what advice would you give as it pertained to that?
Absolutely. So what I teach on is the difference between distress and disorder. So everyone is distressed. Everyone experiences distress in their lives. There is no such thing as a stress-free life. We were not created to be stress-free. So I don't wear t-shirts that say I live a stress-free life, because it's a lie. My body has stress hormones in it. If you remember biology from high school, norepinephrine, epinephrine, fight or flight. I mean, that's stress. So we were created that way. But everybody is not disordered. So there's a continuum. If you continue to remain distressed, sooner or later you will become disordered. And when you become disordered, that's when you know that you need to seek help. Disordered means that you're not functioning properly. And parents, you need to be real with yourself and real with your child when you know that your child is not functioning properly. So Dr. Shepard, what does that look like? Well, my child won't go to school. Yeah, that's a problem. Now, why are they not going to school? Are they just being disobedient and just being hard to go to school? That's a behavior issue. I ain't talking about that type of stuff. You gotta nip that in the bud, all right? I'll leave that alone. But I'm talking about when your child is so anxious that he or she won't go to school. They're so depressed when they won't go to school or won't socialize. It's like pulling teeth to get them to come out their room. They won't bathe. Poor hygiene. Y'all out there know what I'm talking about. Yeah, so poor hygiene, won't eat, poor appetite, or eat too much. Then one of the main things, actually the most common thing for children who are disordered, who have a mood disorder, is irritability. Now, you might say, well, what does that mean? My child gets mad when I tell him what to do. Well, okay, I get that. I ain't talking about that type of irritability. I'm talking about the irritability where you say, hello. And you're like, well, what you mean by that? Hold up. All I said was, hello, how you doing? And you ready to go off on me. That type of irritability, that's not normal. And you know people out there who do that on a consistent basis. Yes. That is dysfunctional. All right. So you know your child. I'm not here to diagnose, and I want to make sure I'm clear. And I'm not here to diagnose anybody's child or even you out there. I want to give you some warning signs of when you have remained distressed. And see, that's the thing about this too, especially in the Black community. We know when somebody is off because we saw the initial insult and we'll just sit back. Well, they'll bounce back, and they're not bouncing back. When they have been off for 2 or more weeks consecutively, that means you got a disorder. Anxiety, which is the most common disorder in children and adults. That means they're fearful of some children not able to go to sleep in their own beds. They won't leave the home. They're always gravitating to that parent, just always worried about this, worried about that, and to the point to where they can't function. That is real. And let me tell you, people's anxiety are on 10 right now because of the COVID-19 pandemic. I mean, you can't even go in a grocery store and sneeze without people ducking and running. And oh my God, you think you have a gun just because you coughed.
Yeah.
Come on now.
I've done that.
See?
Yeah.
I'll tell you, I'll never forget when this pandemic had just started and I was in an Uber and I had a dry cough. Something was just in my throat and I coughed. Lady was like, do I need to let you out? What? No, let me. I wish you would let me out in the middle of this road. Come. I just need some water. And that's how anxious people are right now. Road rage. I know you're talking about children. I know they don't drive. Well, some of y'all children are driving illegally, but road rage, that's another thing. Road rage is on 10 right now out here. I don't know what it's like in Chicago. I've never seen so many people in bad car accidents. And the roads should not be as full because people should be staying at home, or at least, staying within the certain quarters. But I've seen some of the worst car accidents that I have ever seen the last 6 months out here, because people are just moving so fast. They're anxious. I can't wait. I just gotta keep moving. And let me tell you one other thing, and I'll let it go. Parents, if you're anxious, your child gonna be anxious. I'm just gonna tell you. Stop blaming your child for being anxious, and you know that you haven't dealt with your own anxiety. Most times when I see a parent bring little Johnny, he just don't know. And I'm looking at the parent, and of course I don't say, okay, so let's get into this. About 30 minutes into my interview, it's all about the parent. And I was like, wait a minute now. I thought it was supposed to be about little Johnny. Well, I'm feeling something too. It almost happens without fail. So parents, you have to be real with yourself. When you keep telling, well, he misses his dad. No, you miss the dad, and you have now displaced that onto your child, and you have not dealt with your own pain and separation. All right. I know I'm messing up here because some people are gonna get upset with me, but that's all right. I know I'm speaking the truth. I'm speaking truth to power, and I want to help you from being dysfunctional to being whole.
Yeah, I almost feel like I'm in church a little bit, like you preaching. Okay, so let me ask you. So if a parent takes their kid to get help, and they see a psychiatrist, the psychiatrist recommends medication. I have two questions there. One, do you think a parent should explain and talk about this diagnosis with their child? And is that dependent on age and so on? And two, let's just talk about medication, because that's another big issue, right? The taboo, especially with ADHD, I've heard a lot, all of the myths about the medication and so on. So let's go there. Let's talk about, first, should the parent talk to their kid about this diagnosis? And also let's talk about medication, even as it pertains to kids and mental illness.
Absolutely. As a parent, you should talk to your child about what's going on within them, because most children know something's off. Most children know that something is, not where it should be. They may not be able to explain it, but they realize that something is just not right, and it bothers them. And so you as a parent, you need to utilize whatever terms, speak to them on their language, ask them, just don't tell them, ask them, how are you feeling? And that's one of the things that I do with children. You have to ask them and listen to them. So yes, I advocate you explaining to them what is going on, but in their own language and at their own.
What would be some examples? What would be some examples of language a parent could use? Would you say?
Absolutely. So saying hyperactivity or impulsivity, don't use those words. So, hey, you can't sit still. And, you feel like you always got to move around, and you always got to run out to the street after something. Or another good one is when, when you start something and you can't finish it, or when you go here, there, and yeah. So describing the behavior as opposed to putting a term to it, if that makes sense. So describing what they're doing will actually help them to understand what is happening. And that's what I try to do when I explain things to adults and to children. Just talk about what is happening. And normally that will help them to understand. And then let them know what's normal versus abnormal. Now, certain things are normal, a robust child or rambunctious child. Yeah, I get it. But if that child can't finish his work, it takes them, now it's only 5 problems, and it's taking you 5 hours to do it because you can't sit still. That's a problem. All right. And so something like that. Now, medication should be considered when a person is disordered. So I already talked about what that means. So a medication is not always the cure-all for everything, but a medication does provide the assistance that is needed. I prescribe medication. I have no problem prescribing medication for a child because I know that it works. Medication in the right hands with people who know what they're doing works, period. Anything that is in the hands of anybody who does not know what they're doing can be dangerous. So don't throw the baby out with the bathwater because there are people who don't understand what they're doing when they're prescribing medication for children. I'm an advocate for medication for children because I know it works, because I know what I'm doing. And it took time for me to get to that point. And there are people out there besides me. I'm not the only one, by God. Oh God, that would be a huge, There are people out there much smarter than me who look like me, who know what they're doing. And so you just got to be able to find them. And so, and they don't always look like me. They're not always Black. All right. You don't have to have a Black physician if you're a Black person. All right. Stop subscribing to that myth. There are people who are white who do understand what Black people go through. I know somebody don't like me now. Okay, that's all right. Because I've been to some Black people who don't understand what I'm going through. All right. So I'll just keep it real. All right. I'm looking at them like, come on now. Anyway, so you want to make sure you're with somebody who understands. And the last point, medication is a cap. So it puts a cap on all the disorder or the symptoms that a person is experiencing. So anxiety, for instance, it helps to keep that anxiety at a level. So now the therapist or clinician can come in and work with that person to be able to manage those symptoms with other behavioral techniques such as breathing, relaxation breathing, helping them with the thought patterns that they have. So medication is beneficial.
All right, thank you. So what would be some good, what could we look for if we're exploring, if somebody wants to explore looking for a psychiatrist for themselves or for their kids, what would be some good signs? What are some of the things we should look for in trying to assess for a good doctor, a quality doctor? What do you recommend us doing? Because that's often some of the question marks, right? Is this person good or not? What would you recommend?
Absolutely. So number one, speak to people within your community. Typically, there are folks who you know who see a therapist. They're just not telling you. They keep it a secret. So look for referrals. So ask the people who you trust within your family, within your circle. You can even go to your primary care doctor and start there. I can give you some names of websites. The American Psychiatric Association. That is a great association to go to, and they have names of physicians. You want somebody who is reputable, who's a part of organizations such as that. The American Academy of Child and Adolescent Psychiatry. I'm a part of both of those associations. The Black Psychiatrists of America. All right. These are different associations where you can go to their websites and you can go and find people who should be sensitive enough to be able to handle what you're going through. If you're out in my area, the Black Mental Health Alliance, that's one of the major things that we do is refer people to culturally sensitive clinicians. That's the key, not necessarily people of color.
Right, culturally
sensitive clinicians. That's what you want.
Thank you. And what would be a red flag, or what would be some red flags, would you say? And I think this is really important because people often will hesitate because they don't know where to start or how to even go about looking. So what would be some red flags, would you say?
Some red flags, when you go to meet with the person and they don't look at you eye to eye and spend enough time getting to know who you are. If you feel like you're rushed, then you probably have been rushed. So I hear people say, well, I go to my primary care, he only sees me for 15 minutes. I have a primary care doctor here in Maryland, and I sought after, and I found him through a referral. You know, this man spends 30 minutes with me, sits down with me and talks before we do my annual physical. You don't find that too often, but they are out there. So I trust him, and he is not a Black man. And so there's certain things that that I asked him to do. And he said, well, you're a little too young for that. Well, actually, I want you to know that I have certain family history. I have prostate cancer in my family, strong history of it. And my dad got it in his 50s. So when I turned a certain age, I was like, I want my prostate. Well, you too young. Did you hear what I said? I would like for, and when you advocate for yourself, that's a key. So if somebody keeps pushing you back, well, no, you don't know what you're talking about, you need to run. But if you can partner with somebody and you feel comfortable enough to trust that person, that is where you know that you found a good person. So the red flag is they're always resistant, telling you don't need to do this. Now, again, it needs to be within reason. If you've been on Google and you don't did all these crazy searches, and you think you got cancer and all you do is got an upset stomach, then okay, yeah, I'll be a little bit humorous there, but I'm just saying, we want to make sure that you develop a rapport where you feel like somebody is hearing you. And if they don't hear you, if they keep on pushing back, that is a big red flag. If they don't spend time enough with you, then that's a big red flag. If they don't really value who you are in your time, then that's a big red flag.
Okay, thank you. And so, like, I used to have parents, even with the medication, that would say, I don't like this medication because my kid is like a zombie. And I would say, well, that's not right. That's not how the kid is supposed to be. Can you speak to that? Because I feel like, sometimes they are the medication mismatches, and that ends up being a deterrent. So they've tried it once and then they don't anymore. Can you speak to that?
Yeah, again, like I was saying earlier, the medication in the hands of a wrong person can be dangerous. Now, I've made some mistakes, and I've made some, to be honest with you, I've come to find out that's why it's called the practice of medicine. And I know some people are like, oh, that don't sound good. But first of all, we're human. And when we're practicing, I tell people what the risks and benefits are. All right. And I have not made any mistakes that would cause someone to hurt themselves or to or even die. Thank God. And I don't ever plan on doing that because I practice safely. But I will tell you that some children are on medications and they do. I've heard that look like a zombie. I can safely say I don't have any persons in my practice that look like a zombie. And I treat thousands of children over here in Maryland. If anything, they're under medicated. To be honest with you, they're under medicated. Anytime where a person has not acting the way, as we said, a zombie, then that needs to be reevaluated. And you have that right to talk to the doctor about that. Let me tell you though about ADHD though, and this is the last point I make. Sometimes we've gotten used to that child being so hyperactive that we forgot what normal looks like. And that's an important point. So you saw little Johnny running around, pop, pop, pop here, pop, pop, pop there. Now when he's sitting down, you're looking at him like, what's wrong with you? That's normal. So I have to remind parents what normal looks like. They're so used to abnormal and got, so ingrained. And many times that's probably the more common situation than the child being overly medicated. But I have seen some overly medicated children, and that's typically with physicians who have not been trained how to dose medication in children or don't really take care of enough children to know what they're doing.
Okay. So with ADHD, let's talk a little bit about that. In regards to the medication, have you found specific medications to work? This was one of the questions that you noticed work for most. And what about the outcomes in girls versus boys and the medication, the discussion about the medication stunting growth and all these pieces. What have you with ADHD medication specifically? Can you speak a little bit to that?
Yeah, absolutely. ADHD medication works. All right. Ritalin works. I know Ritalin got a bad name because people were using it for different things. But you have to remember, Ritalin came out in the 50s and we didn't have a lot of other alternatives. So people were just throwing Ritalin at certain diseases and diagnoses. So Ritalin works. I use Ritalin. I use long-acting Ritalin called Concerta. It works. So we have to make sure that we know what we're talking about. And because you had a bad experience, I hear you. And so many times I will not use a medication that someone had a bad experience with because it traumatizes them and takes them to a certain place. So I just leave it alone. So let's try something new. And there's different preparations that are out now. So there's Vyvanse, there's Focalin, there's Metadate. There's so many. There's about 20, to be honest with you, that you could use, and they all work well. So you just want to make sure that whatever medication that the person, the doctor chooses, that you understand the risk and benefits and when to give it. And let me tell you, ADHD has to be treated with medication. Folks don't like it. Point blank, research, statistics prove it. Again, you can't debate me on that one because the research shows it. You cannot treat ADHD with therapy alone. You will be beating your head against the wall. And if it does work, I'm probably telling you it's not ADHD. ADHD requires medication because there is a hyperactivity of the brain that therapy will not treat. And so I just have to tell people, again, people don't like me, but I speak confident and strong. I've been in this field long enough to know what works. And I'm telling you, the children come back and tell me I can now learn. I've had children who are in therapy for 2-3 years. It's not about the food. I know a lot of our foods are geared up with sugar and does make children more hyperactive, but that's not the type of hyperactivity I'm talking about. The hyperactivity I'm talking about is your child's on 10 from the moment they wake up to the moment they go to bed. That is ADHD, and that will only be treated with medication.
Wow. So from what age can a child get medicated for ADHD? What's the youngest child you've ever given medication to? Can I ask?
I know some of y'all gonna be scared. 3 years old. Mm-hmm. And they were fine.
Wow.
They were fine. At Johns Hopkins, we had a specialty clinic where children came in between 3 and 5, and we had to give them medication, and it worked. So in my outpatient clinic, I don't normally start at 3 because they normally don't come to me that young, but 5 years old, absolutely. Yep, and
wow,
works.
Wow. And is there any truth to the medication stunting growth in boys or girls?
Yeah, that's the thing.
Is there any truth to that?
The thing that the research has shown is half an inch. Half an inch. That's it. So if you were supposed to be 6 foot, you're going to be 5'11" and a half. Now, if that's what you want to risk versus you being able to learn what's going on in school, you know, again, everybody has to make their own decision, but it's only half an inch, you all. It's not stunting your growth. And let me also tell another one. It's not going to make you addicted to drugs. That's a lie. It is a lie. It's a lie that has been permeating through the Black communities, and we need to stop it. There's certain things that makes me embarrassed as a Black physician that I hear our Black people talking about. And they love to argue. See, I don't argue with folks. I let them do whatever they want to do and do it because my time is valuable. I don't have time to sit here and waste about what is right. If you want the help, you can get the help. I know it works. It's been proven. But yeah, your children not going to be addicted to, they're going to get addicted to drugs when they're trying to self-medicate when they should have been on ADHD medication and they could have alleviated the problem. This is from children who I see in the detention centers. Go ahead.
Yeah, I know Valencia's gonna go, but this hits home for me because my 10-year-old's been diagnosed with ADHD, and I've been contemplating, whether or not he should get meds. And it's even as a professional who worked with kids, it's still scary to think about. Is. So thank you for sharing these truths. Go ahead, Dr. Wiggins. Go ahead and share your question from the chat.
Yeah, Dr. Shepherd, I'm just wondering, how long does the process, once you say prescribe someone medication, especially a child, what's the process? How long do parents see before they see a difference? how medication is working? How do you walk like your patients through that?
Great question. ADHD medication, you'll see a difference in 1 or 2 days. I tell parents, you will see, you'll be looking like, where did he go? Like they just sitting there playing so quietly. It is amazing. Parents would call me and be like, why didn't I listen to you earlier? It is amazing. ADHD medication works like that, and then it's out of your system. So ADHD medication does not need a buildup like many of the other psychiatric medications. It's in you and it's out of you. It should last for 12 hours and it's done. What I have seen happen is when parents take breaks for a extended amount of time, sometimes the medication won't work as effectively. So I tell parents, there are no summer breaks. ADHD is not going to stop just because it's the summer holiday or just because it's the weekend. No, what type of sense does that make? Well, it's only for school. You will never hear me say it's only for school, because there's children who have gotten into accidents, who have hurt themselves, who have done because they were so impulsive and they were on the medication during the weekday, but on weekends, they were able to roam freely. Now, again, everybody can do whatever they want to do. But as far as what I train and work with my parents on, who are in my practice, that's what I tell them. Now, mood medications, anxiety medications, you have to take those every day, and in order for them to build up into your system to work effectively. And we have to find a therapeutic dose, which means the amount of medication that it will take to help to put that cap on and it stay there. Last thing I'll say is that if we're going to be on medication, we talk about 1 year's time. All right. And then we reevaluate 1 year. Oh, Dr. Shepherd, that's too long. No, it's not.
Really?
No, it's not. It's not too long. 1 year goes by so fast. And so many people can't do 1 year. And that's okay. I don't beat them up. I know they come back and say, man, I wish I had stayed on it for a year. And then we have to sometimes start over. But 1 year's time. And I do take children off medication. I take adults off medication. I'll do it because they've been stabilized enough to where they now can move forward with their lives and know how to be able to handle those mental health issues.
Okay, well, all right, thank you. So someone asked, how would I know if my child has anxiety? So the child is 5 years old. How could you tell if your child, like a 5 or 6 year, if they have anxiety?
Yeah, so it depends on what anxiety. A lot of children who are 5 years old, they have separation anxiety. So they won't allow you to leave their room when it comes time to go to bed, or they're always jumping in your bed. You never can have privacy. And so, and I'll be honest with you, there are certain parents, especially single parents, they like for their child to sleep in the bed with them. And again, I'm not knocking that, but you need to understand at certain developmental stages, your child at 10 years old should not still be sleeping in your bed, if at all possible. Now, again, certain circumstances, I'm not getting into people's housing situations, things like that. That's a different situation. But there should be a time where that child is able to separate from you and they be okay. If your child is constantly calling you every time you leave home to figure out where you are, and they're just a mess, then that anxiety has gotten the best of them and is not allowing them to function. If they're scared to be around even people who they have known or won't socialize with other people. Now, again, some anxiety is healthy. Again, stranger anxiety, they shouldn't just be walking up to strangers and saying hello and all that. No, not at 5. But when they can't even be around their own cousins, they can't be around their own grandmothers and things like that because they're so anxious, that's when you know that you have a problem. So those are just some of the things that I see in a 5-year-old.
And have you seen it manifest in physical symptoms at all?
Absolutely.
Tell us a little bit about that with kids.
Abdominal distress, which means stomach aches. Always run into the nurse. The nurse is where you find your 5-year-old child because they're always complaining that their stomach hurts, their head hurts. just, those are probably the most common things I hear as far as physical manifestations. So absolutely. Headaches. Yeah. Those are some of the physical manifestations.
Okay. Dr. Wiggins, you want to go ahead and ask your question?
Yes, I have a question. Sarah Levi wants to know, how do you know when you found the effective dose for ADHD meds?
Very good question. So you know that you found the effective dose when that medication is at its lowest dosage, but it stays in your system for 12 hours. So that's how you know. ADHD medications that is extended release. I should say it like that. Now I'm getting a little bit too technical now, but medication should last in the system when it's extended release for 12 hours, and there should not be major side effects. Now, for certain children, they may not eat as much. And so I hear parents complain to me, oh my God, they're not eating as much. Oh my God. And the child's not losing any weight. So that lets me know that they are eating something. They just not, again, we've gotten used to our children eating so much, they're eating so many snacks, this and that. Now I will say, if a child starts losing weight more than 7 pounds, that's my cutoff. Then I say, okay, no, something's wrong here. But if a child is not eating as much, make sure they're eating their breakfast before they take the medication, and make sure they're eating dinner. Sometimes they may not feel like eating lunch. And sometimes their body's just kind of getting used to the medication. And then I've seen it turn around very quickly. A lot of our children are picky eaters too. They just don't want what we serve them. And then we say, well, it must be the medication. No, it's not that. It's a picky eater. So you got to be able to know the difference.
So let me ask you, going back to the anxiety issues. So I had a friend who her son really struggled when he was at school to eat. Like, even if she sent him with a school lunch or anything like that, when he was in the lunchroom with all the kids, he would really, even though he was hungry, he would really struggle to eat. Wow. Do you think that could be anxiety as well? Like, he would come home and eat his lunch that was in his lunchbox. Do you think something like that can manifest?
Absolutely. Yeah, that could be a sign. I won't say it is because I haven't assessed him. Right. So it would be not proper for me to say that it truly is. But yes, he could have some type of social anxiety about eating in front of other people. It could be that he didn't like his lunch, or he's embarrassed by what his mother is serving him. I mean, there's so many different things that could
lead to that.
Yeah.
Okay. Let's transition now. Let's continue talking about this pandemic. So I feel, there was a study that actually came out of Harvard Medical School, and that really showed that all of our stress levels, and I know I want to know what you've been seeing, but all of our stress levels have gone up, right, with this pandemic. And so even thinking about anxiety with the kids and with the adults, can you talk about what you've been seeing now with the pandemic? In the kids, in the adults, what have you been seeing in lines of distress and all these pieces? How is the pandemic affecting families?
Yeah, anxiety is at the top of the list. Anxiety is at an all-time high. It is something that children are dealing with, the adults are dealing with. Anger. People are angry. Parents, children are angry. They're spending much more time in closed spaces together. They're getting on each other's nerves, irritability. So that's the second thing that I'm seeing. Sadness due to grief, and not just necessarily death. And that has been one of the major things that we've seen. Death due to the coronavirus, but sadness due to not being able to socialize with their friends. That is a loss of not being able to celebrate certain milestones. So if you're experiencing a death, you're not able to attend or have the memorial service that you would want to have. Loss of not being able to attend a graduation or a prom or something else, a birthday, a significant birthday or some type of significant event that you normally would celebrate with a huge gathering. So those things are what I'm seeing. as far as what people are struggling with. I'll say this, my show rate for probably about 12 weeks was 100% between
Wow.
March and June.
And that never happens usually, right?
Oh, no. I don't care how good you are. It ain't gonna have a 100% show rate. But let me tell you, telehealth, and people were just sheltered in place and they knew that they needed the help. Plus, I had to become flexible. I had to start seeing some people on weekends. I vowed I would not see patients on weekends. But because their parents were essential workers, they had to work sometimes 30 straight hours because someone didn't come in because of the coronavirus. This is real life, you all. And the child now has been left home alone because the parent had to be at work. And I can't see children by themselves, not as a psychiatrist, because of what I do requires parental supervision. And so I remember seeing a child and their parent on a Sunday. I had never seen somebody on a Sunday unless I was back in residency or fellowship. So,
Wow.
it required flexibility. I'm working as hard as I have ever worked before, as far as an outpatient. But yeah, it's, burnout, burnout amongst my colleagues. I have to make sure now that I'm taking care of myself even greater, exercising more, self-care, saying no, and meaning it. Sometimes we say no, we don't mean it. But no, saying no and mean it and stick to it. So these are just things that I'm witnessing on both ends of the spectrum.
Yeah, it's real. Someone wants to know. So they have a 12-year-old son and he's going through puberty. So with that milestone of puberty and what they really feel is that anxiety from the pandemic and remote learning, how could that parent support their son? How would you recommend that they support their son?
Yeah, and we talked a little bit about this earlier. Number one, communication, listening is so important, especially when a child is in that transitional age, going through puberty. There are things that they're feeling and understanding, beginning to understand about their bodies that they don't know. So communication is key. That sounds simple, but you'll be amazed how hard it is for somebody to listen to what somebody is saying. Parents, you want to tell your child what to do, how to do it without them saying anything back to you. No, we got to listen to what they have to say. And I have to do the same thing as a physician. Sometimes you ready, this is what you need to do. This, like, go A, B, C, D, and then you'll get E. I need to stop before I even go to A and just listen to what someone is saying. Most times when we listen to somebody, they'll figure out what's going on within their own selves before we even say anything. So some people will say, man, Dr. Shepherd, you really helped me. And I'm thinking to myself, no, I didn't. I just listened to what you said and just said it a different way and gave you the result that you wanted or the prescription that you needed. So that's how you become successful. So when that child is going through puberty, listen, and then talk to them in terms of what you know about puberty. Let them know that these are some of the changes that you should expect, and be open. Now, it's going to be a little bit embarrassing, but if you're comfortable, and sometimes you got to fake it until you make it, and you don't want to talk to your child about sex, but you just got to get in there and grin and bear it. And you just look like nothing's bothering you, but inside of you that there's this, it's tearing you up. And so many times I do that. People will be amazed. Well, I don't have a poker face, so but I'll say this, as a parent, you gotta sometimes you just gotta fake it. And then as soon as they leave out that room, you be like, oh man, ooh, that was tough. But the communication is key, and being able to be available to the child is also key.
Okay, all right. Thank you. Do you foresee long-term, so I think about the lack of socialization now. A lot of our younger kids, especially, like my one was supposed to start kindergarten, and somebody asked with the younger kids, do you think there will be a long-term impact for the lack of socialization with this pandemic?
It's possible. It is very possible. I am disturbed by what is happening within our school systems. First of all, we're not on equal playing fields. We talked earlier about how in healthcare disparities, when it comes to education, it is just as bad and sometimes even worse. We are not on equal playing fields when it comes to the health and the education of our children, and it's shameful. I can live in a city such as Baltimore and know what type of school you go to just by calling out his name, whether or not are you getting a quality education for that child. That shouldn't be. And it's the same thing in Chicago. Oh, I know it is because I grew up there. Let them go to a Lane Tech. And then let them go to what isn't Garfield Park High School? I can't remember.
Well, there's several on the west side.
Austin.
Yeah, Austin High School. Yeah.
Oh, now tell me, Lane Tech versus Austin. You know, is it the same?
No.
No. Now, some people will say, well, it shouldn't be the same. Well, there should be a certain standard. And so that's what bothers me. So with all this said, my point is that, yes, it's bothering me because there's certain children who are going to be afforded opportunities during this pandemic to try to keep them on level, but there's going to be some who are not, and they're going to decline of no fault of their own. In Baltimore, we have a huge digital divide, and it's probably there in Chicago too, where parents want to get their children into school, but they don't have the internet infrastructure. They don't have the equipment. How is it that you can have 4 children who have 4 different teachers at 4 different grade levels, and school starts at 4 different times, so you need 4 different devices? So what you going to tell that mother? You got to buy 4 different computers now? And this is real. This is what is happening. So is there going to be a long-term effect? I hate to say it, it's very possible if we don't do anything to even up that playing field. And that's where we have to speak out. That parents, you got to speak out. You got to say, this is what I demand from my school. Don't sit by and be passive, but you got to make sure that you demand that your child gets what he or she needs.
Thank you. And speaking with the remote learning, a lot of kids are doing synchronous learning where they're tuned in. Is there too long a time that, with all of this screen time for the kids, is there too long a time that can be really harmful for the kid? Like where it's no longer effective or harmful, and just thinking about all the screen time? What is the research showing even about screens and all of these pieces?
Yeah. Ooh, that's hard. I can't give you the exact amount of hours, but even before we had virtual learning at the level we have it now, too much screen time, as we know, is not a good thing. It's not good for me. I gotta wear readers now. I'm seeing patients now on the screen. I'm doing all my notes. I gotta use these readers now. I didn't have to use these readers before the pandemic. This eye strain now, man, come on. So it's affecting our eyes. It's affecting how I view things. So for children, we have short attention spans, and it's gotten shorter because of what our society has allowed and grown into. So we have to be engaging. So I can only imagine what it is like for teachers to try to keep a child engaged. I think you mentioned you have a kindergartner. How do you keep a kindergartner engaged on virtual learning? What? So you got to be creative. So I feel for the teachers out there. So I don't know the exact number of hours, what you got to do, but I do know that it's got to be something that will keep the children in tune, what is happening. And so I can understand why they want to get the children back in the classroom, some type of hybrid learning or whatever methodology they're going to use to get the children back into school. But too much screen time definitely is harmful to you physically and to you socially, because then that's all you learn. You don't want to interact with other people. I know some children who like, man, I'm glad I don't have to go back to school. And I'm looking at them like, no, you the one who need to get back in school, because socially you're underdeveloped. And so we need to make sure that we recognize where our children lie in this state of being, as far as emotional maturity and versus not just giving in to whatever they want to do. Hopefully that makes sense what I'm saying.
Yeah, no, it does make perfect sense. Now, as we prepare to start wrapping up shortly, Dr. Wiggins has a question that just came over the chat. Dr. Wiggins, you want to go ahead?
Yeah. So Dr. Shepherd was asked, what are some steps to take when teenagers are self-medicating with periodic vaping without parent knowledge or consent, and anxiety and medication?
So I want to make sure they're self-medicating with vaping.
Yeah.
Okay.
They might be on medication, but they're also vaping.
Okay, gotcha. I was waiting for the marijuana. That's what I was waiting on. That's more common than the vaping.
Yeah.
Vaping's got that bad rap now from Juul, even though some people are still doing it. Yeah, but vaping is not good for you because you don't know what you're inhaling. And there's a lot of metals that is causing lung scarring and even fibrosis and damage. So when your child is self-medicating, wow, what steps do you need to take? Man, I don't know if there's a good answer for that. Again, we go back to the communication and the listening. And be open and honest with your child. Hey, I recognize that something's going on. You're different. I smell it on you, don't ignore that smell, Oh man, that was just my partner. No, come on, man. Be real with me. Are you using? And then let them know what the effects are of using. Before we start beating them and all that, let's listen to what they have to say. All right. I will say this: you need to be able to let your child know what marijuana can do. And I'd rather stay there than the vaporize, than the vaporing. Marijuana can cause a child and adult to go into a psychotic episode. Marijuana is not benign. I've treated children, adolescents, who have had psychotic breaks after smoking marijuana. Now you might say, well, that marijuana was laced with something. It could have been, or it could have been a hybrid, could have been purple haze or some of these other ones that are out there. But we have to know and educate our children about what the use of drugs, including marijuana, can do to your brain. And then, let's get the help that they need. If you know if it's anxiety, if you know that it's mood, seek the help. Go with your child. Let's say, hey, we're going to do this thing together. One of the major things, I'm going to end right here. One of the major things I see for success in children and adolescents in particular is when that parent is involved with that child's treatment, and not just say, hey, you need to go get help yourself. No, get involved. They may kick and scream, but when you find somebody, I'm just thinking about a patient I have now. He found somebody who he likes, and everybody's saying, well, he's just a bad kid. And let me say this: stop calling your child bad. Stop saying these things about your children. Good. Good drug addict. This. We realize that they're struggling, but when you flip the script and say, you know what? I still see good in you. I still know that you're getting this, and celebrate it. And when you start changing up on them, it will make a difference. I've seen it happen, girls and boys. All right.
Okay. All right. Thank you. So as we wrap up, there's one more question as it pertains to this pandemic right now. Before I ask you for some of what you want to leave our audience with. So one of the questions that was asked was this person's a high school teacher, and they've seen some high schoolers die by suicide and struggle with mental illness. they wonder, with the pandemic, will there be a point where the mental health struggles our children and us are facing become more dangerous than the risk we face returning to normal school? So that was kind of the question, given what they've been seeing and what they've experienced being a high school teacher.
All right, I'm gonna have you repeat that question to me just to make sure I got the gist of it.
So basically, will there be a point where the mental health struggles, so, you know, we're with the pandemic and we're at home and remote and all these pieces, will there be a point where the mental health struggles we're facing become more dangerous than the risk we face to return to normal school?
Oh, I got you. Yeah. Yes, and for each person, it's different. Yeah, you know, I think about the doctor who committed suicide, who was on the front line in New York. Here she is. Can't remember her name off the top of my head, but it went viral. Um, you know, she was out there helping people, but the weight of the pandemic became so much that she couldn't take it, and she ended up ending her own life. I use that as an example because the weight of what so many of us are going through unexpectedly and having to change the way in which we live has affected us so badly that some of us will say, I'd rather not be alive, or I'd rather not function. And what I'm afraid of, and I think this is what the question is getting at, that we're going to have some people that when the pandemic subsides and finally ends, they're going to be so stuck that we're going to have to literally come and get them out. There's a term that's called long haulers. Long haulers are those persons who were infected by the coronavirus, and after they have no longer had the coronavirus be positive within their system, they still have the long-term effects from being ill from the virus. Case in point, breathing issues. You might have had the virus back in February, but it's October now. You still can't walk up a flight of stairs because of the virus and the illness that you encountered. There are going to be people who are like that emotionally. Let me say that. There are going to be some long haulers who are going to suffer emotionally because they were shut down for so long and they can't bounce back. And that's the thing that concerns me, is that we got to get those people help. We got to get to those parents. We got to get to those children. So yes, are we at risk of that? Absolutely. And so we got to know the balancing act, to know when to be able to move. Because let me tell you, there are some aspects of my life, yes, I'm going to keep on hold until the pandemic is over, but my whole entire life will not be put on hold. There are some new things I'm doing this year that I am so excited about, and I just feel a fresh wind right there because I am so excited about it. And so you have to find what it is in this pandemic that will keep you going and keep you encouraged and keep your children going, so that when the pandemic does end, and it will end, that you won't be the long hauler emotionally and or physically.
All right. Wonderful, Dr. Shepherd. So as we conclude, I want to ask you, what would be your takeaways you want our audience to leave with? And what would be some words of hope you can give those who are watching? So what are some of those key takeaways? Or, you know, I know it's been a lot of heavy content tonight, and it's a heavy topic as we discuss, you know, mental illness in our community and the pandemic and everything else. So what are some of the takeaways you would like to leave our audience with, and maybe even some words of hope if you have any?
Oh, absolutely. Oh, there is hope. We have to know there is hope. So my words of hope can be summed up in PCWC. This is my mantra, and I thank you for this, and I love this, and I get even more passionate about the PCWC. PCWC stands for potential, cope, work, and contribution. This is the definition of mental health. Mental health is not scary, it's not spooky, it's not vague. It is a clear-cut definition. It is a state of being where every individual understands his or her own potential, knows that he can work or she can work, and can now work effectively. Can cope and then work and then make a contribution to your community. So let me break it down even more. PCWC, you have to understand that this is the measure which we have to look at all of the things in our lives. So I ask you, how's your PCWC? How's your potential? What's potential, Dr. Shepard? That is your untapped ability and skills that lie within you. So that's your mental health. That's what if you got good mental health, you're going to know your potential. You're going to know who you are. That is wonderful. And then if you got good mental health, you're going to be able to cope with the stresses of life. I talked about that earlier. We're all going to have stress, but you're going to know how to be able to cope with it better. And you'll know how to overcome those obstacles when they come your way. So that's the hope that we have. Then work. We have to work. And I am not just talking about working to get the paycheck. I'm talking about working productively, working fruitfully. There is that type of work. And thank you for saying that. I work and it's exhausting. I've been working today since 10 a.m. doing shows, doing different things. You might say, well, this don't look hard to you. Well, you know what? It is hard. I'm just passionate about it. That's what's driving me. But I'm working productively and fruitfully. And so can you. So I want to let you know, if you got good mental health, you know your potential, you know you can cope, you know you can work. And then the last one is C, make a positive contribution to your community. Man, if everybody understood that about their mental health, we would be so much better. So again, how's your PCWC? Check your PCWC. Every time you wake up in the morning, hey, how's my PCWC? My potential, my ability to cope, my ability to work, and I'm going to make a positive contribution to this community. That's what I want to leave with you all. That's what mental health is all about. If you are able to recognize, tap into that, we will be a better community. You'll be a better person. Your family will like you more. You'll like yourself more. I mean, it just permeates, and it'll make you even smile, and you even do better physically. So that's what I want to leave with you all.
Oh, wow. Words of wisdom there, Dr. Shepard. So if people want to reach you, or if people want to hear more from you, how can they do that? Please share.
Absolutely. So I am tapped into all social media aspects. I have two live podcasts every week. I am on a podcast on Fridays through my job, Hope Health Systems, 6 p.m. Eastern Standard Time. You can go back to the library, to my Facebook page, or to Hope Health Systems Facebook page, and look at all those shows that we have done. I just mentioned to the panel here that I just did a series on the mental health of the Black female, the mental health of the Black female. And it's been an awesome series. So you need to go check that out. You can go to my YouTube page. That's how you spell my name down there. Shepherd, a real shepherd, one who leads. And so make sure you spell it right. And then the second one is a podcast I do on Saturdays at 12 noon. This is more of a critical collaboration between a mental health professional and a faith leader. And so as you can tell, faith is a huge part of what I do. It's part of who I am. And so we have a wonderful dialogue. We're not scared to touch any subject. We're not scared to go into politics. I know people are sick of politics. I am sick of it myself, but you need to understand how it affects your mental health. And so we're not going to a slant to tell you who to vote for. I'm past all that. You need to know what's happening in our society and the injustices that are occurring within our society affect every person, including white people. All of us are affected by what we see. And so we need to make sure that we are listening to people. I heard this point that people are tuning into Facebook and to social media aspects, social media avenues more than they are reading newspapers right now. That's a problem. because people are getting their information from social media more so than they are other reputable resources. So that's why I'm on here, because we got to have a balance. I hear some crazy stuff on social media. And it's like, oh my God, people can get on here and say stuff like that. So check me out. Sorry for all the ad lib here. Friday, 6 p.m., 12 noon on Saturdays. Hit me up on my Facebook page, Twitter page, J Shep, Dr. J Shep, DRJSHEP. That's on Twitter, Instagram. If you need direct care services, Hope Health Systems, look us up. If you're in the DMV area, Hope Health Systems, hopehealthsystems.com. I always say we'll do you some good. So those are ways in which you can reach me.
Wow. Well, I am so elated, Dr. Shepard, that we could get you here tonight. I mean, there's been so much knowledge you've shared, such a wealth of information. You know, we touched on a lot of topics, and I can see your heart and your passion in this, that you're not just doing it. And it comes from a place of commitment and a place, you could see a place of ministry and a place of really wanting, you have your PCWC there, you know, and your contribution, you're really contributing. And you talked earlier about mentoring, you know, young men of color who want to head into the medical field. And I'm so thankful that there are doctors out there like you and men out there like you who are willing to share and to lead and to continue even as we traverse these difficult times. So I really want to, on behalf of Colorful, say thank you so much tonight on behalf of everyone listening out there. We're so grateful for all of the wealth of material you shared and your wisdom and everything, for taking the time out of your busy day to meet with us. And again, if anybody look him up on Twitter, on Facebook, Dr. J Shep, he's out there. I'm sure you can Google him. You can find information about him, listen to his podcast if you want to hear more from him. And to you who followed us at Colorful, stay tuned, you know, as we will periodically bring you and share these panels with you. So to everyone out there, have a good night, stay safe, and stay well. And may God bless you. Thank you. Take care.
And I want to say thank you so much, Dr. Shepard, for your time. Good night, everyone. We'll be back on Colorful. You can watch this again on our Colorful YouTube channel. Thank you.
Still there.